It's never too late to start taking care of your health. It's also never too early. Too many men, however, fail to make health their priority or the least part of their daily routine. As a result, they put themselves at a risk of getting otherwise curable diseases like prostate cancer and erectile dysfunction. There are also several common age related health problems that men face. To discuss everything about men's health and how they can be prevented, we have with us Dr. Krishnappa. Welcome to the Health Side, Dr. Pramod Krishnappa. So, to begin the conversation about men's health, what are the most common health problems in men due to poor lifestyle and work related stress?
So the diabetes, hypertension, which is high blood pressure, and the obesity, that is excess weight gain, and also the mental health issues like depression. And also of late, there has been an increase in the incidence of infertility and sexual dysfunction cases because of the poor lifestyle.
Okay. Since we are talking about lifestyle, smoking and drinking habits are very common in men these days. How can these habits affect these health?
Okay, the cigarette smoke contains around 7,000 chemicals, and excessive smoking can lead to so many health issues. For example, it can cause respiratory lung issues, it can lead to heart disease, and also can increase the risk of stroke. The excessive smoking also affects the endothelial layer in some of the organs, for example in the penis, which can lead to erectile problems as well.
Okay. So coming to the erectile dysfunction issue that you just mentioned, what are the real causes of erectile dysfunction? It's a very common issue these days in men.
Yeah, so the erectile dysfunction, it increases with age, and the definition of the erectile dysfunction is basically somebody who is unable to achieve or maintain an erection. The causes could be multifactorial. It could be due to psychological cause, or it could be an organic cause. In the organic cause, again, there is a big list of conditions that can cause, but diabetes is one of the most common cause for erectile dysfunction.
So since you mentioned diabetes, which is also India is the capital of diabetes. So when it comes to men, what are the trigger points for diabetes in men? What can cause diabetes and how they can prevent themselves?
Yeah, so the trigger points for diabetes, again, a family history, both mother and father being diabetic, will itself up the risk of a person getting diabetes. Apart from that, then there is, like I mentioned before, abnormal poor lifestyle changes. A sedentary lifestyle can be the risk factors for somebody developing diabetes. And also, we need to watch the food we eat to avoid eating foods which have very high amount of sugars in it.
Right. Other than diabetes, there is hypertension issue as well, which is also a cause of concern these days. How common is it in men? How the issue is common among men?
Yeah, so the hypertension is basically the increased blood pressure. So this increased blood pressure mainly happens due to the excess salt in the body. So in the food intake, we need to watch the excess salt intake, and the hypertension also can develop because of the work stress levels. Yes, and hypertension can be treated with losing weight as a first instance, as a lifestyle modification, and of course, in some of them may need medications as well.
Right. When it comes to cancer, what are the most common types of cancer we see in men?
Yeah, in men, the most common cancer is the lung and the oral cavity cancers. The other cancers which are next in line are the stomach, the colorectal, esophageal. All these constitute, including the oral cavity and the lung cancer, all these, whatever I mentioned now, they all constitute to up to 45% of the cancers. I, being a urologist, the prostate cancer is also on the rise, and it is somewhere around 6 to 7%.
Right. When you talk about prostate cancer, which age group in men are at a higher risk of developing prostate or testicular cancer?
Yeah, the prostate cancer increases with age after 50 years. Just to give an example, the around 13 out of 100 men will develop prostate cancer in their lifetime. Not all those who develop prostate cancer, it may not be significant in some of them, and again, only the significant ones will need extensive treatment.
Right. When we talk about the low testosterone level, can it lead to other health problems too? What are the health problems that it can lead to?
Yeah, so the low testosterone levels in the body, the two things are of main concern. One is it can affect the fertility, and then it can affect the sexual function. That is, it can lead to erectile dysfunction. Apart from these two, there are many other important functions of the testosterone. It is important for the bone health. If a person having very low testosterone hormone levels can have osteoporosis of the bone, and it is also testosterone is also important for the muscle mass and also for the mobilization of the fat in the body. And also recent reports have come up saying that the Alzheimer's disease is high in those who have low testosterone. And a recent interesting study has come up in context to the COVID, which mentioned that the people who had low testosterone levels had higher complications of COVID.
When we talk about menopause, we always think about women. Is male menopause a myth or it's true?
Yeah, the male menopause is called as andropause, and this concept is still evolving. And like I said before, the testosterone levels tend to decline with age. So when a man reaches around 45 to 50 years, if he experiences symptoms like easy fatigability or poor libido or erectile dysfunction and increased osteoporosis of the bones and so on, if somebody becomes symptomatic, then definitely this andropause needs to be addressed. But otherwise, a routine estimation of testosterone in these patients in the andropause phase is as of now not recommended.
Right. Like we said, like you said, like daily habits, lifestyle habits can affect a man's health. What are some of these daily habits that they should refrain themselves from, to make sure that after 40 or post 40, they don't suffer from all these deadly diseases?
Yeah, see, if you're talking specifically about the testosterone deficiency, there is nothing much that can be done with the diet. No diet, as far as I know, can increase the testosterone levels. But yes, following a healthy, balanced diet, which involves less of unhealthy fats and to avoid excess high sugars, to avoid excess salt, all these should not be part of the majority of the bulk of the food that we eat on a daily basis. And other few of the important things one needs to follow is that, especially in these difficult times of COVID, we have been restricted to our houses since it's almost been a year, and it's getting difficult for many of us to go out, exercise, and get involved in healthy activities. So my suggestions to many of them is that if you have a terrace, just go onto the terrace, expose yourself to the sun, which will give you the natural vitamin D levels in your body, and also just do some stretching exercises or any simple exercises for 30 minutes, for half an hour, which will take care most of your illness at present. And yes, some of the cancers may not be identified at a early age, but yes, following some of these precautions and doing some of these things might help.
Right. When we talk about vitamins, what are these important vitamins and other micronutrients that a man's body needs?
Yeah. See, the body needs so many multivitamins, so many minerals, there's so many micronutrients. We cannot pinpoint and say, oh no, this is very important, you need to take this vitamin. No. So all micronutrients, all vitamins, all minerals are very much important in the body. That's why we need to have a balanced diet, which is full of fruits, vegetables, and also to include dietary fiber in the diet.
Right. When we talk about the diet, what should they refrain themselves from? Like, the daily habits of exercise and all is understood, but when it comes to smoking, alcohol, should they refrain themselves towards, limit their consumption level to make sure they are healthy, or can that affect their health?
Yeah, so like I said, the smoke contains around 7,000 chemicals. So there have been studies where they have done studies. They've made three different groups. A research study wherein one group they did less than 10 cigarettes per day. The second group did 10 to 20 cigarettes per day, and the third group more than 20 cigarettes per day. At the end of at the end of 6 months to 1 year, what they noticed was that the abnormalities in the cholesterol, also in the sperm levels of the young individuals, those who had more than 10 cigarettes per day, that is the second and the third group, the abnormalities both in the blood and also in the sperm abnormalities in the young individuals were significantly higher in those who did more than 10 cigarettes per day. That doesn't mean that one has the liberty to smoke 10 cigarettes per day. This study basically said that those who do more than 10, the results are very much high.
Right. Apart from other health issues, men's intimate health hygiene is also very important. Can you share some of the tips from your end for our viewers so that they can also keep things clean out there?
Yeah, so this is a very good question because we as a urologist we come across this issue very often. Um, the many men do not clean the skin that is at the tip of the penis. Many of them do not even know that they need to retract the skin that is at the tip of the penis and clean it while taking bath on a daily basis because a lot of secretions can get accumulated and that can cause a chronic irritation at that part, and also some of them they even get infections, recurrent infections at that site. The somebody getting infection is more in somebody who has uncontrolled diabetes. So cleaning the prepuce, the skin that is the tip of the penis, is most important. That is the most hygienic, important thing that a man should follow. And yes, because if that is neglected, the infections may get transmitted to the partner as well.
Right. This is related to, I want to relate this with the HIV issues or, any other infections that can spread from intimate, like keeping it unhygienic. So if you want to share something on that as well.
Yeah, of course, HIV has been there since many years, and to some extent, cure has been possible in some clinical scenarios. The important precaution is, of course, to wear condoms. There is nothing else that can prevent from contacting HIV wherever possible, especially with the new partners, to please use condoms. That's a simple and straightforward answer to this.
Right. Apart from this, do you have any other advice for our viewers so that they can take the best care if they're when it comes to their health, especially at the time when our country is fighting against the deadly coronavirus?
Yeah, so apart from the mask up and the social distancing, which has been told n number of times since past 1 year, apart from this, I request all of you to be, at least like I said, go onto the terrace. If you don't have a terrace, at least open the YouTube channels, do some exercises at home by following the online classes so that you can keep yourself fit. And many of them are restricted to the house since last 1 year. So try as much as possible to not to smoke excessively. In fact, it is better if you could quit smoking, and if you really don't want to quit alcohol, at least take it as a social drink on a very occasional purpose. But try to quit smoking as much as possible.
Right. Thank you so much for giving us your time, for sharing all the valuable insights with our viewers. Thank you so much, Doctor.
Yeah, thank you. Thank you very much.